and welcome to the WFMT Research Video Forum series. I'm very excited to be here today with Dr. Marija Pranjić. Dr. Marija Pranjić. She is the postdoctoral research fellow at Harvard University and Boston Children's Hospital. It is a delight to have her here with us today. So welcome, Marija.
Thank you so much for having me.
I hope that you could just get us started by telling us a little bit about your research.
Well, first of all, thank you so much for having me here and for the opportunity to reflect on my research. Um, just as a little bit of a background, I first received my bachelor's and master's degrees in piano performance in my native Croatia before I moved abroad to pursue my music therapy studies. Then I did some clinical work across different settings and across different countries. And all of these experiences really served and continue to serve as a foundation for my current research and research questions. And I must say that I felt that as a music therapist, I was really trained to understand different dynamics in the room and how to use music purposefully. Um, but I did not really understand the mechanisms of what I was doing. And for me personally, that was always something that would make me less satisfied with, my clinical skills. And for example, I think as music therapists, we've all experienced that, you see that a specific technique works well for one client, one child, but does not for the other one. And it's not just about their personal preferences. And so around that time, I started reading more about the neuroscience of music, about neurologic music therapy, and I felt that this literature really helped me answer some of my questions, but I knew that in order to be an independent researcher who can answer all of my kind of complicated, complex, clinical, messy questions, I needed to gain some new skills. And so this led to my PhD with Dr. Michael Tout at the University of Toronto. And if you ask me this same question about like 10 years ago, I would probably get very quiet and just feel that this topic is very intimidating. But now I see that my research skills are really a tool that help me kind of transcend disciplines and also answer various questions. I'm really curious about musicians' health, about everything I experienced as a classically trained pianist and all of my colleagues as well. But then also all of those questions from my clinical work that I understood that there was a meaning in the room, there was something that I was doing that I was trained to do really well, to adjust, to adapt. But I was always struggling to really kind of replicate that to the extent that would be satisfying to me. So this is kind of a little bit of a background in terms of what led me to becoming a researcher. And I think there is a bit of my personality as well, where when I have a question, I really need to have all these different perspectives and my own knowledge in order to be satisfied with kind of the conclusion I have at the end. So, kind of to start with something that I'll probably end with is that I don't think that every music therapist should have all these research skills, and it takes time and effort. But I think that research can really help us um, really replicate and be more confident and expand on our clinical skills and our clinical impact moving forward.
Mhm. It sounds like some of the questions maybe that arose in your research studies were kind of fueled by your clinical work, right? You were talking about wanting to understand what was happening in the room, that kind of mechanism. And we see that research now, there's a call for a more mechanistic understanding of responses to music. Perhaps you could tell us about one of your many research studies and just talk a little bit about the method that you used and, of course, the research question and some of the outcomes.
Sure. I think I still very often think about my doctoral research. It was not that long ago, and it was a lot of effort. But um, in my research, I I was really motivated by the literature, when they say like music moves you not only emotionally, but also physically. And I still find that very fascinating. I mean, I've been a musician for the first 25 years of my life, and I never thought about the role of music and movement and how that can really be powerful in therapeutic settings. So that was something I found very exciting as I started kind of gaining my research skills. And then through my clinical experience, I also have seen the role of rhythm in movement disorders with adults. My main question and curiosity was, can we replicate the same effects in kids who have motor coordination difficulties? Because we know that there is just um, kind of very big difference in terms of the architecture of the brain in the early development and later in life. And so for my doctoral research, I um, basically wanted to test whether we see the rhythmic entrainment in children who have motor coordination difficulties, and also um, can rhythmic auditory cues, or like in future music-based interventions, help them improve their movement. And so I was doing that, combining kind of behavioral measurements and EEG measurements, and was able to see that this was indeed effective. And I didn't know what to expect because of all these different mechanisms. And I thought that maybe, when we add music, very similar to stroke rehabilitation, if you add more, it can lead to less. It can lead to something that we don't want to see as therapists. So I really just wanted to test, because of that like very dynamic brain development that's happening in early childhood, maybe the addition of rhythmic auditory cues would make those kids more variable. And I was really excited to see that I was kind of wrong in that direction, and that indeed we see what we see with adults, and that those mechanisms that we use very and rely very often in our clinical work are present in early childhood. And I think that was the kind of then the foundation for me to start asking questions. Okay, we now know that there are many kids with different neurodevelopmental conditions that also, in addition to their kind of primary area of difficulty, also have difficulties in motor coordination. And so how can we start to understand maybe more precisely what would be the role of those rhythmic interventions in early childhood, and also how can that help us understand the brain in general? I think that's what I love about my role as music therapist
Mhm.
and as a neuroscientist, is that sometimes, I use those music related questions to learn more about the brain, and I use my neuroscience skills to help kind of really pinpoint some of the questions that I always had as a clinician, and that then I always had at different conferences and conversations with my colleagues.
Hmm. I mean, it's you have a wonderful skill set yourself. And I wonder, about perhaps researchers that are wanting to get started, right? Clinicians wanting to get started in research, or even researchers that have specific skills, but maybe don't have a skill in one area. Could you maybe talk a little bit about the benefits of interdisciplinary research, or how you yourself have maybe collaborated with other disciplines in designing and carrying out a research study?
I think this is a skill as well, and it's such
Mhm.
an important skill. Um, I think all of my research so far has been interdisciplinary. I cannot think of a single study that did not um, that was kind of confined to a specific discipline. Um, I I think that when we talk about health, it's really important to just understand that it's so broad, and I think that's not news to anyone. But when it comes to research, we invest so much time and energy into conducting it, right? It's hard, and that's why I think that that early stage of study design is critical. So that's the time when we really want to have people with perhaps different perspectives on the same question at a table very early on. So we try to at least reduce the bias that already exists in research. And I think it's very prevalent in music therapy research.
Mhm.
We see I think the meaning during those sessions, but I think sometimes meaning is equal to effectiveness and sometimes it's not. And I think understanding the difference and understanding how we can use different methods to answer those questions. And I think when I talk with my colleagues, very often I hear I'm a qualitative researcher, I'm a quantitative researcher, I'm a mixed method researcher. I would not put myself in any of those categories, right? When we are conducting interviews together, working on a
Mhm.
specific project, that's the most meaningful method and way to go forward to answer some of our questions. When we are curious about, all the questions that we had about the pandemic and telehealth, the global international survey was the most meaningful way to at least gain some understanding of how people are responding to something like a pandemic. And then if we are thinking about our role of music in music-based interventions in pediatric rehabilitation, I think that it's really important to understand what are the methods that will help us answer those questions. And collaboration is truly crucial. I think as a researcher, I always want to be independent when it comes to my own skills, so I understand everyone. But I think it doesn't matter how qualified you are if you are tackling a really um, like a true clinical question. You should think about having those collaborations, because I think then it's no matter what your outcomes are going to be, it's going to improve the knowledge that we have in the field anyway. So regardless of those p values and any numbers or any words, they're just gonna help everyone better understand how we can move forward as a field.
Yeah, thank you. I mean, what I take some wonderful points from what you've said is also the critical importance of choosing the right research method to match what it is that you're studying. And I think that, sometimes maybe that doesn't happen, right? If someone feels that they are only a qualitative research, I'm not saying only, but that's maybe their preferred method. Maybe that method isn't the best, or that approach doesn't answer the question in the most robust way. So I think really looking at what you need to answer your question and what is the best way to get to that source of data and that information.
Exactly. And if you don't feel comfortable um, leading that part of research, that's why we collaborate. And I think
Mhm.
um, I have lots of different thoughts, and they're not critiques. I always critique myself first because I want to make sure that, I also have of practice across different countries. And I feel very privileged to be in this part of the world right now, because I know that in my home country, the field is at a very different level of the development. And I know that that's true for many people who are joining our like conferences and different webinars. So it's really about trying to understand, okay, what are your skills? What are the questions that you want to ask? How can you collaborate with people if there are some areas where you feel like your method, the method that you feel comfortable with, will not do it justice, will not be able to match what you're looking for. And I think that's why there's a difference between having, when we talk about clinically driven research questions, that's really important. But I think it's really important to also understand the methods, the just the variety of methods, having that knowledge to be able to link the two and to see how can we kind of go in both directions. How can we use those observations and then match them with the best possible methodology, and then match that with the best possible team, so we can have the results that are not just one publication, but are really helping us again move the field forward when we go to those conferences year after year and maybe are hearing very similar
Mhm.
reports on the difficulties and the challenges. And also um, I think we are all very aware of a number of systematic reviews and different types of reviews on the benefits of music-based interventions.
Right.
And um, that's wonderful to see. I think the challenge is, as a music therapist, you don't see that in your clinical work. You don't always see just the benefits. You see all this kind of very complicated questions. And so I feel like there is a lot of maybe people feel pressure to explain what music therapy is, how effective it is, because many of the things that we see in the room cannot be measured. And so, but I think finding the right balance in a way we communicate the benefits and the effects of music-based interventions, and then we still identify the gaps so we can then create those research studies that will specifically address those gaps, will not repeat and kind of replicate the things that we kind of already know, if
Yeah.
that makes sense.
It does. I think I mean, that's really where a lot of good research studies are going to get their impetus, right? Is looking at what has been established and then looking at the gap, right? Because it's, I think sometimes in many disciplines, people, are doing really good work, but they're maybe working independently or in silos, right? In their little team, in their smaller team, and not necessarily connecting it to similar research that's being done elsewhere. And so maybe magnifying the impact of all the research we're doing by having these broader collaborations to
Mm,
move our questions forward. Um,
yeah, I agree. Yeah.
so I wonder maybe if you could tell us, I mean, you've studied in different parts of the world, you've also lived in different parts of the world. Is there any researchers or research that has been really inspirational or motivating for you in kind of pursuing research or in continuing your research trajectory?
Great question. I I I think I cannot single out one project or one kind of group of researchers that have inspired me, but I think there's a lot of exciting research that's happening at the moment and a lot of great initiatives.
Mhm.
Um, that are again at that intersection. And I think what you kind of mentioned a little bit earlier, I think intersection can be is absolutely exciting, but is also challenging. I think of myself as a researcher, and then I'm a musician, I'm a music therapist, I'm a neuroscientist. You just put things together, but it's not that easy. It's really kind of there's an extra work in trying to do it meaningfully, and I always admire those initiatives and research teams. There are quite a few around the world that are focused on the link. I know this is very broad, but the arts and the sciences, the arts and sciences. I always think about that Venn diagram and kind of what's at the intersection. And I love when I come across a researcher at a conference or a research paper where I can see in their writing that they're writing creatively. So I know that science, research could be very rigid, but seeing the art in the sciences and
Mhm.
also seeing the scientific questions within like the musical questions, if that makes sense.
Mhm.
So it's not about making it more quantifiable. It's really about asking questions that you don't think about very often. So being very curious and very creative um, in how you select and write up your results and your methods. So I've seen like when I think about musicians, it took me many years to start to think about musicians' health, to even starting to think about musicians' health. And then to start to think, oh, I've been through this, my colleagues have been through this. Um, so funny. I never thought that other people are dealing with this. And so seeing those initiatives and those research teams that bring on a musician who is not a researcher or scientist to truly share their experiences, and then to have a neuroscientist who maybe does not have that much experience but has very important questions. So I think kind of bringing that the overlap of that Venn diagram of how to link arts and sciences, that's what typically makes me really exciting when I see um, a research paper or someone's webinar really trying to tackle that in a creative way.
Yeah. Lovely, because I think sometimes people, get worried that research, takes out the creativity, takes out the musicality, it's
Yes,
not
yeah.
fun or, it gets a bad label sometimes, that people are scared of it, right? They're scared to pursue it. As an instructor and professor at university, I see that students are often fearful of research. And I
Mm.
think, simply being able to understand that the best research really does come from oftentimes trying to explain something that is happening or is not happening when we are trying to engage people in music therapy and music-based interventions.
Exactly. And I think still that is a skill. Some people do it
Mhm.
effortlessly, but I think it's a skill and something to that we should strive towards. Like I remember when I wrote my first essay that was like more like a research paper, and I shared it with my husband, who is a musician. And I just told him, "Can you quickly read through this? That like the topic doesn't matter, but just to make sure that you understand, does it make sense?" And then his feedback was a little bit like, I still think about it because he said, "Oh, it's great. It's just a little bit boring." And then I got I got a little bit mad because it's like I put so much effort into it. But he
Mhm.
was right, and we joke about it because true, I did not have a skill or even I was not brave enough to, submit this assignment, but to also have a little bit of like, when I read those research papers, they can be very boring, but there are some other research papers that are written better. So what is the writing skill or creative aspect of writing that makes it still engaging within those confounds of the rules that we know exist within the kind of scientific writing? And we often talk about that kind of the first feedback I received from him, and I was a little bit mad, but then I really understood what he was trying to say as a musician. And now I'm trying to do my best to, when I'm teaching, when I'm writing, when I'm presenting at conferences, to try to adjust that knowledge. So it's not one of those presentations when you're talking about, methods, results, these numbers, this, reflections and so on, but it's really about, okay, how do we make this interactive, although I'm the only one speaking now because I'm giving this presentation, but how can we just think about a more creative way to even like make it accessible but also more enjoyable? So again, I think that's a skill, but if you don't think about it, you will not get there. So something to think about. And definitely when I'm teaching, I'm kind of trying to encourage that side of writing and research does not have to be rigid. It is, very often it is, and it has to be, but not always. So kind of again that Venn diagram of trying to understand where we can pour some more creativity without getting a rejection from the journal because
Right.
it's not in a good format and things like that.
Yeah. I mean, that speaks to a lot of different ways I could take this conversation. It speaks to, how do we engage other ways of knowing, right? I mean, we've definitely privileged for a long time in music therapy research, kind of Western methodologies, right? And how do we also ensure that we are, incorporating other ways of knowing and being within the research literature, and also I think just how do we creatively present our research to different audiences? I wonder if you
Mm.
could talk to us a little bit about how you might present your research study to, students or to perhaps healthcare individuals that don't know about music therapy, right? And how could you explain your research to them, or even caregivers that are looking to potentially bring the person they're caring for to a music therapy experience? How might you tailor the conversation to different audiences?
I think again, that's a skill that keeps I hope I'm getting better. I think I've recognized a few, like based on someone's responses, I've recognized some of the things that I think to myself, I'll change it next time. I think many of us have also experienced that when you start explaining what music therapy is and music and health, sometimes to like medical professionals, I've seen two patterns. One is they feel like, oh, you're talking about something we're not doing here. Like it's such a like it's almost like entertainment, and you kind of lose them as soon as you mention music for some reason. And then there is a different group of people who hear that, and then they go like crazy, but in a positive way, which is also the kind of they stop listening. So, for example, you would say that they're like, yes, music is, you know, does everything, they are not even questioning it. And I think what I want to bring them, what I'm kind of, I'm always paying attention to how they're reacting when I start describing music therapy. And I think the truth is somewhere in between. I want them to understand, but then I also want them to understand that that this can um, look and kind of go in different directions depending on the country where this is practiced, depending on a clinical setting, and like depending on many many other kind of smaller questions that we can talk about. So I think my first my I'm always paying attention. I don't have a spiel, like I don't have a, this is, as a music therapist, this is what I'm going to tell you. I'm kind of trying to pay attention and to see that I don't lose them as soon as I mention music. I'm pretty sure this is not only my experience, but sometimes, yeah, it's either very positive or very, very like, oh, we don't do this here. And so to try to get them engaged, get them realize that, give them some very quick clinical examples from saying, okay, musical training to Alzheimer's to Parkinson's disease. So there are lots of different stories, and very often people realize they also have made that connection in their heads, never really articulated that. Um, so I think that's my approach. But the hardest part, and my biggest kind of learning curve in this context is going back to my Croatia. And so very often, I mean, I didn't know what music therapy was when I was an undergrad student. I've never heard about it.
Right.
Um, remembering that that's probably the case in many other countries makes me um, really be flexible. Sometimes we are tired as music therapists of explaining what we do, that it's effective, all of that. But I think starting from my personal experience and then trying to again find those smaller case studies of good examples that people in my area can relate to. And then once I get their attention, I think that's where your conversation actually starts. It's not just about me explaining it, but them asking questions and me making sure that I have, I don't just repeat things that I always repeat to other people. But it is challenging. I think it's exciting and challenging at the same time. So I wonder, like, what's your experience? Because even with all of your knowledge and experience, and probably being surrounded by people who understand music therapy very well, you must be in situations where you're kind of trying to gauge how they might react or
Right.
um
Oh, for sure. I think, one thing that I hear from many music therapists around the globe is this constant need to advocate for what it is that we're doing, right? And there's a lack of sustainable funding, right, that goes into providing for music therapy. That seems to be, unfortunately, quite prevalent
mm,
in many parts of the world, including Canada, where I live, which has, quite abundant resources, but money is not allocated by the government, for example, to music therapy. So I
mm,
do find that there's a lot of people that still to this day have no understanding, have never heard of music therapy. And then others, who have, right? And sometimes I'm almost surprised by it in a good way. I'm like,
yeah.
oh, you have? That's excellent. And there's still a lot of misunderstanding. And I think part of that has to be also on us as music therapists and on healthcare professionals in how they talk about music-based interventions in their writing and their research. Because what we see sometimes is that music therapy, when it's connected in healthcare contexts or music interventions, everything is grouped as music therapy, right? So
Hmm. Hmm.
any music and health experience is music therapy, whether there's a therapist involved or not.
Yeah.
And it's sometimes music therapists need to do a little bit better job at describing what it is that they're doing. And Dr. Sherry Robb and colleagues have just put out the updated music reporting guidelines, which I encourage people to also look at who are doing research. And the rigor in reporting how you are using music is essential if we're going to actually drive the knowledge home. So I've diverted a little from your question, but I think part of the issue is that we don't always describe well how music-based interventions are different from music therapy, but are also valuable.
Hmm.
When I speak to different audiences, I love the way that you approach that, Maria, talking about like you gauge it. And that's, I mean, I do a very similar thing. Like, I don't want to assume that someone has no understanding of music therapy or
Hmm.
do, right? So I'm going to start with a conversation about what do you think music therapy is? And
Yeah,
from
yeah.
there, I get a sense of where do I need to go with that conversation. I do think bringing the music in can be really exciting for different audiences, including, something that's maybe more considered scientific, but bringing in that experiential component, because I honestly believe that when people see and engage in music therapy, they become believers of the benefits much more than reading the clinical results.
Hmm.
So I recently did a short presentation at a conference with a colleague who engaged in music research with me. She was the music therapist that provided the services. So I talked about the results, but then we did the experiential component where she demonstrated what she did. And I think that's much more engaging, So I think this combination, as you spoke about so eloquently, of bringing the creativity into the scientific information you're imparting, which is also very valuable, is critical. So yeah, so thank you for highlighting that. I wonder if we might also talk just a little bit about, I guess, where do you see the future of music therapy research, or what might you be pursuing next in your trajectory? Or yeah, I guess maybe just talking a little bit openly about music therapy research.
I think I have, as you know, lots of different interests, and the more I learn about different methodologies, the more questions I have and the possibilities I see. So that's the really exciting part. For me, currently, I am primarily based within the division of developmental medicine, working as a cognitive neuroscientist. And so I'm working with other researchers on really big and important projects related to brain development and all these different kind of variables that come into place when it comes to impact of like early adversity, uh, sensory development, motor development, cognition. And our main focus is really understanding the link between the brain and behavior. And that's kind of a really nice continuation of my doctoral research. And so what I'm kind of discovering right now personally is that I've always thought about music and music-based interventions in a role of like not rehabilitation, but for example, something happens and then here we are uh, providing interventions. And I know that within our trainings, we're always taught that, music therapy, we're not doing the diagnostic process and all of that. But for the first time in my life, I just started thinking about um, the role of auditory perception and auditory development and rhythmic timing. And so all of these elements that happen in the brain very early on, within the first few weeks, they're already kind of formed. Um, how can we start to think about potentially engaging in like helping with the diagnostic profiles that relate to those domains? Um, for example, we know that across different neurodevelopmental conditions, including autism, ADHD, dyslexia, dyspraxia. Those kids, one subgroup of those kids have auditory perceptual differences. And so the more I learn about biomarkers in my current research, I don't think there will be one biomarker for ADHD, one biomarker for autism, or anything like that. So my focus personally is really thinking about those subgroups or profiles. And I think that what makes me excited is just recognizing that there might be a space and a role for our modality for understanding even more music from the beginning and not just how it happens in the brain, all those like mechanistic aspects, but how can we start to think about it and provide research and understanding of how we might use that very, very early on to start to predict different trajectories. So that's the kind of role of different biomarkers in neurodevelopmental research. But for me, obviously, personally, that aspect of auditory and rhythmic development just makes me very excited because again in clinic you start to notice that we all know that there is lots of like heterogeneity in neurodevelopment, but I think it would be really very powerful to have our role in that very early development and to help really understand the diagnostic process as well through our modality. um, I'm not sure if that makes a lot of sense because this has been something I've been thinking about over the last few months. The more I engage in these very, very different research projects. But I think it's just exciting, and that's why I highlight when people ask me about a PhD or different programs. It we're all different. I invested a lot of my time and energy into like gaining my own skills. But I think it's really important for us as educators to think about different PhD programs within music therapy that could provide you some skills. I mean, the courses that I took were from different departments, from like I think biostatistics, neuromotor behavior, from kinesiology, from neuroscience. So I was really able to do that within my PhD program. But to be able to give them the tools, because that's the beauty. You are then able to kind of step in other people's fields and to see, oh wait, this is actually this could be a really important clinical research or something we can start to think about. So um, kind of very broadly, I'm really excited about those, like thinking about rhythmic timing as a transdiagnostic biomarker across neurodevelopment. And then, on top of that comes music and passion for music and everything we see with kids. And, that would be such an easy early intervention because, as we know, kids already are so getting so much from music.
Mhm.
Um, I don't know. This is something new that I've been thinking about. Of like being a music therapist, I always saw myself of like you know, healthcare system. You come here, you work on something, whereas understanding any systems, but like brain development and starting very early on and seeing those trajectories, and then as a music therapist, jumping in and out at different time points. But yeah, being present very very early on.
Mhm. Wow, it sounds very inspiring, and we can definitely see your passion, Maria, in terms of really thinking about, where music therapy research could go. And I really like, in that, in the time that you were speaking, I also hear some really glimmers, for people that are thinking of pursuing a PhD program, right? Yeah, I think you've given some great tips about
Mhm.
really consider the program you're pursuing and the types of opportunities that it could present in terms of the courses that you might want to structure to build the skill
Mhm.
set that you desire as a researcher and music therapist, clinician moving forward. So I think that's really wonderful. Um, I think maybe we're coming closer to the end of our time, so I'd like to just open it up to, is there anything that you would like to share to, new researchers, or just any other words of wisdom or thoughts that I haven't asked you about that you'd like to conclude with about research?
I'm always trying to be very careful about any giving any advice because I highlighted for me this curiosity about neurobiological mechanism. It was,
Mhm.
I was a very effective music therapist before that. I personally needed to know how to answer some of those questions. And I recognized that I had my gaps in my knowledge because my entire education up to then it was based on like a musical background. So I really, the idea of picking up a calculator was absolutely terrifying in my first year of PhD. But I think there's so many motivated music therapists in the field who come with different ideas. And as you said, I think the key thing is to recognize what do you want. If you want to be a researcher, very typically you would um, try to pursue a PhD in our field. What do you need from that program? Not just like getting in and getting that like degree. It's really what you need. And some people do need a degree because they're already very happy with what they have, but it's kind of more driven from that kind of perspective. But I think that considering different aspects of what you need to get at the end of your PhD will define how you spend those years of hard work and to be satisfied with your outcomes. I know that I really worked hard on joining different labs to just volunteer and help with putting the EEG cap on on Saturdays and Sundays and things like that. But I knew that this is something I want to be doing independently. Um, I think I think music therapy is very diverse and very rich, and I think that's an amazing aspect.
Mhm.
And that's also a very hard one when we think about kind of narrowing down any of our main takeaways. So I think no matter what the clinical context and maybe just different theoretical approaches that people have, I think we should be more creative and critical. So it's easy to critique anyone's work. It's easy to say,
Mhm.
research is very reductive and so on and so on. I think that having curiosity and that level, good level of kind of critical thinking will lead you to be a better therapist and be a better researcher. So again, going back to the beginning of thinking about, yes, there are so many things that as music therapists we notice in the room, we know they are meaningful,
Mhm.
and we kind of have to accept that probably we will not be able to quantify them ever. I mean, it's a part of it. But what are the things that um, we can understand better and do more effectively? So the difference between, or like the nuances between doing something meaningfully versus effectively. Um, I think that's what every clinician cares about. And then as researchers, if we can continue to explore those questions using methodologies that can help us answer those questions is something that I think will help us all just have better careers and being less burnt out when we need to constantly explain everything that we kind of keep explaining no matter where we go and what we do. But I think it's exciting. I think it's really exciting to see uh, just the diversity of music therapy research and um, yeah, how that's linked to clinical work.
Excellent. Thank you so much. I think, the way that you speak throughout this time has really shown your commitment to open-mindedness and diversity and inclusion and this focus on curiosity, which I think really is very important in the work that we do in terms of even cultural humility and really being curious about how the individual that we're serving is experiencing this, right? And coming to it
Mm,
open-minded, trying to bracket any biases and assumptions that we have to be open to that experience. Um, Thank you so much for sharing more about your own research, about your passion. And you are definitely a star in our profession. And we thank you very much for sharing your time. And we will look forward to seeing many more research publications and presentations that are authored by yourself. Thank you very much, Maria.
thank you so much.